Why did I get vaccinated? Well, if we look at what's going on worldwide, if we look at the fact that more than 2.5 million people around the world are dead from this pandemic, if we look at the fact that in the US now, there's more than 500,000 people dead, I think that alone sometimes should give you the impetus to know that this is real and something needs to be done about it. People have told me about concerns regarding the vaccine, etc. And how come you got vaccinated? I had relatives, um, when I told them I got the first shot, questioning my sanity in getting the vaccine. But the reality is, everyone has to look as an individual as to the importance of getting this vaccine and what it means to them. So for me, on a personal note, being married with kids and working not only in my office setting but working in the hospital where there is the risk of direct exposure, where I'm taking care of patients with this virus, it made absolute sense for me to get the vaccine. Not only for my own safety, but I think about the possibility of myself carrying that vaccine not only to my family, my wife and kids, but also to my patients. As a cardiologist, I am dealing with those patients that we hear talked about as being in the higher risk category. Those patients who've had heart attacks, those patients who have hypertensive heart disease, those obese patients, all of those risk factors dramatically increase risk. So I have to do this, and I did this not just for me, but I did it for my family, I did it for my patients, I did it for my family here in the office to offer them that extra protection. This virus is real, and every day I'm having discussions with my patients regarding this virus, whether or not they should get the vaccine or not, and whether or not it's serious enough. 2.5 million people dead around the world makes it serious enough. 500,000 Americans dead make it serious enough. So yes, it's something that's real and we have to take seriously. Regarding the vaccine and regarding all the concerns, I think all of us as individuals have question marks regarding the speed at which the vaccine was developed, regarding the side effects of the vaccine, and whether or not there are things that are out there lurking to happen in the future. What we know from the scientific data, which is all I can speak to, what the scientific data tells us, most issues with vaccines are recognized within the first 6 months of utilizing these vaccines. We have now had close to 9 to 12 months of data on these vaccines and the side effect profiles that are out there. So we know the vaccines are safe. Worldwide, more than 220 million people have been vaccinated across the world. So, what I tell my patients is, don't look at the University of Google for your information. Go out there and get good information. The CDC has good information. Mayo Clinic, Cleveland Clinic, go to the World Health Organization websites. Go to these websites and educate yourself about it. If you go online and just type in random searches, then you get random information. I strongly also suggest that you speak to your medical professional, your primary care doctors. These are the people who are on the front line. These are the people who are up to date with the scientific information, and they can give you real solid advice regarding the vaccine. I would say I probably have 4 to 5 patients that I have discussions with regarding the vaccine, regarding what concerns they have. So similarly, you can do the same. You can speak to your doctor. Ask whether or not you are someone who is at higher risk because of your underlying medical problems. But you got to get out there and do it. You can't live in a bubble forever. what I'm looking forward to, I'm looking forward to when it is my wife can get vaccine. Once she gets vaccinated, then we can think about relaxing our guard to some extent, getting out there, traveling. We are from the Caribbean. I'm from Trinidad. My wife is Jamaican, and I haven't been home to see my mom in 3 years. So I'm looking forward to that day when I can eventually get to see her. And getting this vaccine makes that one step closer. I miss going to the Caribbean. Every summer, typically, we would go to the Caribbean, either Jamaica or Trinidad, and spend time with family. So I'm looking forward to getting this vaccine. I have had the vaccine now. I'm looking forward to getting out there and moving about, opening up a little bit, breathing a little bit. I'm spending pretty much, this is my best friend, okay? I'm spending 6 to 8 hours with this on my face every day. And it gets a little bit tiring. But I'm going to have to do this at least probably until, I hate to say it, the end of this year. But if more and more of us get the vaccine, the quicker this goes away. The quicker we can return to some semblance of normalcy. And that's, I think, the goal that everyone is looking forward to. And, well, the question sometimes I get is, well, Dr. Foster, did you have any kind of reactions to the vaccine? And essentially what I would say to the first shot, no. Maybe some soreness at the site. The second shot, a little bit of soreness at the site. But guess what? The next day, I went to do something with friends. Okay? So getting the vaccine is something that's safe. I strongly recommend it and endorse it. And if you have any questions, speak to your medical professionals about it. We got to beat this virus before it beats us. Thanks.